Hi, my beautiful friends. Today we are talking about something that so many women deal with, but a lot of people, women and their doctors, don't talk about it. Vaginal dryness and itching. It's uncomfortable, it's frustrating, and guess what? You do not just have to live with it. Hi, I'm Dr. Liz, and today I am delighted to be with you with real talk and real solutions so that you can feel comfortable and confident in your body in midlife and beyond. Let's jump in. First of all, why does this happen? You guessed it. The main culprit is the decline in our hormones as we get older, especially lower estrogen levels. That happens in perimenopause and in menopause. However, there can be other causes, including medications that might dry you out, such as antihistamines, some antidepressants. Breastfeeding and childbirth can cause a lack of estrogen in the body. Harsh soaps or douches, which we shouldn't use any ingredients other than water anyway. Autoimmune and skin conditions. And of course, that catch-all hormone disruptor, stress. Let's start by talking about lack of estrogen. When this happens, the vaginal lining gets thinner and it loses its ability to produce lubrication. This can lead to itching, irritation, and pain with sex. As I like to point out, it's not just a matter of loss of moisture on the surface. It's actually a loss of elasticity in the tissues underneath. This is why lubricants can be helpful, but might not completely resolve the source of the discomfort or pain. We'll come back to that. I also want to point out that the base of your bladder has the same type of cells as the lining of your vagina. Because of this, tiny doses of estrogen, which can help relieve vaginal discomfort and dryness, can also reduce bladder problems, including leakage and recurring bladder infections. Okay, I promise to make a video just for your bladder as soon as possible. Let's take a moment and look at some lifestyle adjustments that can be helpful, and then we'll come back to the many options that are over the counter or that you can get by prescription. First, make sure you stay hydrated. Your whole body needs water to stay moisturized. Stress reduction. You know that stress affects circulation and hormone balance in your body. Eating enough healthy fats supports your hormonal system as well as skin and related tissues, like the vaginal lining. Keep moving. Exercise that you enjoy boosts circulation and helps you regulate and balance your hormones. Because you know how much I love bioidentical hormones, let me now turn to a few different ways that you can use tiny doses of bioidentical estrogen, including estradiol, which is the active estrogen, to help you relieve vaginal itching and dryness for good. We mentioned that the lack of estrogen leads to the thinning of the tissue. It also leads to changes in the microbiome of your vagina. The imbalance of organisms affects the pH, which then leads to the itching that a lot of women may experience. Tiny doses of estrogen can be delivered in all kinds of ways to the vaginal tissues that can help. First of all, compounding pharmacies, super helpful. They can make vaginal creams, they can make inserts. The cream can be used on the outside of your vulva or internally in the vagina. There is a bioidentical estradiol cream available from regular pharmacies that your doctor can prescribe that also works well. It can be a really good starting point for a lot of women because it'll often be covered by insurance. It's also a good starting point for women who've gotten, as I'd say, behind the eight ball in terms of having really severe symptoms. For example, if a woman had some vaginal discomfort or itching and she stopped having sex because of it, she might get to the point where she can't even use an applicator to insert anything into her vagina. But she can still use the cream with her finger to apply outside and even start to massage the tissues and improve that elasticity. As the tissues feel better, she can use more internally. Less messy than the creams are the options of vaginal suppositories. The prescription one goes by the name of Imvexi. It comes in tiny doses, 10 micrograms or even as low as 4 micrograms. That little bitty 4 microgram dose is useful for women who are not all the way in menopause. In other words, her body's still making hormones, but it's not reaching the vaginal tissues. This is really common, for example, after childbirth and during breastfeeding. It can also happen after certain cancer treatments or radiation. Another great option is a vaginal tablet of 10 micrograms of estradiol. It is usually by prescription and is inserted with an applicator that comes with each tablet. The applicator is thinner than any tampon. As I mentioned before, a woman who's already having so much discomfort that she cannot insert an applicator, she can start with the cream. Other patients of mine don't like the plastic that comes along with these vaginal tablets because it's one applicator with each tablet. If a woman does not mind using her finger, she can use the vaginal suppository, prescription, or compounded options. Then she doesn't have that plastic waste. Regardless of whatever method you use, tiny doses of estrogen may be also compounded with testosterone. The instructions are the same. You would use it every night for 2 weeks and then twice a week as a maintenance. Some women respond really quickly and they don't even need the whole first 14 days. They can go down to the maintenance dose even sooner. Some women need to go longer than that to get relief. The typical maintenance, as I said, is twice a week. Some women need it more often, like 3 times a week. And some women do great if it's even only once a week. Regardless of whatever method you may use, the idea is to apply or insert last thing before you go to sleep. That way, the estrogen sits on the tissues overnight to give the best improvement. You also don't want to transfer the estrogen without meaning to a sexual partner. There are some non-hormonal options. One is a prescription medication called Osphena. This is an oral medicine that acts like estrogen on the vaginal tissues, but it is not an estrogen. This is a good option for some cancer survivors or for a woman who's not comfortable using any kind of estrogen. This is, as I said, by prescription. There are also a growing number of brands of vaginal moisturizers, often containing hyaluronic acid. I'll make sure to put notes in the comments below. If you can use a vaginal moisturizer enough to get relief and be able to have intercourse, that having sex will then also help you keep the elasticity of those tissues. While they don't correct the underlying problem, lubricants that are water or silicone based can also be really helpful. The important thing I want you to remember is that if vaginal dryness or itching is a problem, if it's persistent, it's painful, it's disrupting your life, it's time to talk to a health professional. While vaginal itching and dryness are common for many women, you do not just have to put up with it. There are many solutions, and you deserve to feel great in your body. It helps us spread the word for women to feel great in midlife and beyond when you like and subscribe. So thank you for that. Also, please share this video with someone who might benefit from the information it contains. Especially if she's been told that she just has to tolerate it or just has to live with it. Please take care. and see you again soon. Thanks for watching. I'm so excited that you want to feel your best so you can go out and do your best. Don't forget to like and share and subscribe and leave me a comment or a question. I will look forward to that. Talk with you soon.